Before the start of the long weekend, groups representing paramedics warned that people who call for an ambulance in Ontario may have to wait longer for one to arrive. This is primarily due to healthcare staffing shortages and temporary emergency room closures, which were predicted to slow down the response times for emergency services. Ontario's health minister says the system is facing pressures due to the challenge of maintaining the required staffing levels. And this problem is not limited to Ontario, as staffing shortages are impacting healthcare systems across the country. Well, with us now to discuss the impact of these staffing shortages on paramedics in particular is Mr. Deines, president of the Paramedic Association of Canada. Sir, welcome to Forum Daily.
Good afternoon.
So let's start with how this long weekend was for paramedics amid these staffing shortages.
Yeah, thank you. So the long weekend traditionally is a very busy time for paramedics. We see lots of people going to enjoy the outdoors and recreating, which in turn creates more ambulance calls and requests for service. So normally it's a busy time in the summer anyway, but you couple that with the recent shortages and closures with medical facilities around the country, places an enormous strain on paramedic systems from coast to coast to coast.
And in addition to this, we know offloading delays are also responsible for tying up paramedics. So what exactly are offload delays and how long could these delays be?
Yeah, so an offload delay happens when a paramedic crew arrives at a medical facility, traditionally an emergency department, and the department is so overworked and with so many patients that they're unable to accept the patient from the paramedics, which means that paramedics have to stay with the patient, traditionally either in a hallway waiting for to be triaged and placed into a bed, or in some extreme cases that we're seeing now, we refer to ramping, where the patients remain inside the ambulance on the front ramp of the emergency department waiting to be triaged and placed.
And can these delays be seen across the country, or are certain regions more affected than others?
Definitely, it's a problem we're seeing across the country. As you can imagine, in larger urban and metropolitan centers around the country that are experiencing higher than normal call volumes, coupled with shortage in staff in both the paramedic system and the healthcare system globally, it creates this vicious cycle where there's just not enough staff to take care of the patients inside the facilities, and there's not enough paramedics to respond to calls for assistance.
So how are Canadian paramedics feeling amid these staffing shortages, offload delays, and the pressure from the job itself?
Yeah, as you can imagine, the last 2.5, 3 years have been a very challenging time for paramedics and paramedic dispatchers around the country. With obviously the COVID pandemic has placed an enormous challenge on the work that we do. In some jurisdictions in Canada, we've coupled that with, for example, in British Columbia, the opioid crisis, as well as the recent climate emergencies are all compounding on workload, stress, and burnout on paramedics. And then you couple this now with a staffing shortage, both in paramedic services as well as healthcare facilities, and it's really taking a toll on paramedics from around the country for sure.
And bringing this back to our viewers, how are all of these factors, these compounding factors, as you say, impacting patients and services overall?
Yeah, well, as you can imagine, if the paramedic crew is waiting at a hospital on an offload delay or is unable to staff an ambulance because of paramedic shortages, then that's one less ambulance that's available in a system to respond to people in their time of need. And prior to COVID, many systems in Canada are operating at or over 100% capacity to begin with. So anytime we add an additional strain onto the system, that translates directly into delays in responses for paramedics.
All right. Well, meanwhile, we saw these emergency department closures or reduced hours during the long weekend. Could you see this becoming the norm due to staffing delays?
Certainly, it's become more and more common in our experience around the country. With delays to access healthcare facilities, or in some cases, paramedic crews having to bypass a hospital to go to the next closest community because they are shut down. And again, that just adds to that pressure on the system, where if you take a paramedic crew from one geographic area that has to go now to another one in order to transport a patient to another facility, that's one less ambulance that's available to respond in that community. So it's definitely an ongoing issue. And without some immediate intervention, the problem is only going to get worse.
An issue that definitely needs to be solved by our officials. We'll definitely have to keep an eye on this situation. But Mr. Deines, thank you again for joining us today on Forum Daily.
Thank you so much.